Hello, welcome as you're getting onto the webinar. We'll wait just a few seconds until we have our participants entered from the waiting room. For those of you already entering, I'll let you know that we have lots of information available at our website, www.lebonheur.org/coronavirus. And we will get started in just a few minutes when I get all the participants in from the waiting room. Thanks for joining us. Welcome. We may have some more folks joining us in a little bit, but we want to welcome and get started promptly so we can get lots of information out to you guys and take questions tonight. We, as the Bonheur Children's Hospital and University of Tennessee Health Science Center Back to School Task Force, believe that safety is a top priority as our children return to school this fall. We strongly support that children need to be in school, not only for learning, but for a variety of other benefits. We've been saddened but not surprised to see evidence mounting at local and national levels that children have experienced significant learning loss in the past year or year plus. For many children and families, there have also been significant stressors and strains to mental health during that time. We want to help you and be a part of the community that keeps kids safely in schools. The coronavirus Delta variant is creating confusion and questions for schools and parents related to the latest guidance and best practices. This evening, we have pediatric health experts from Bonheur and the University of Tennessee Health Science Center to provide the latest information on best practices to ensure safety for students, teachers, and staff as school gets back in session. There are things we can all do to make our schools and communities as safe as possible. We are here for you, and we plan to offer some general information first, then we'll have our experts take questions. We may not be able to get to all submitted questions during the hour we have with you, but we'll try to get additional information posted to our website as we go. We have been maintaining a website for quite some time now, and as I mentioned to a few of those, a few of you who got on just as we opened up, we have a website at www.lebonheur.org/coronavirus. We keep current information on a wide variety of related topics for healthcare providers, educators and school administrators, and of course, families and community members. So I want to introduce you to our panel tonight. First, I am Tony Whitaker. I am the Division Chief of Developmental Pediatrics at Bonheur and UT Health Science Center. Dr. Sandra Arnold is the Division Chief of Pediatric Infectious Diseases at Bonheur and UT. Dr. Nick Highsmith is the Medical Director of Infection Prevention at Bonheur and UT Health Science Center. Dr. Cynthia Cross is the Division Chief of Pediatric Hospital Medicine and Bonheur on the Move and School Health Services at Bonheur and UT. Ms. Cindy Hogg is the Director of Health Services for Bonheur. Dr. Mary McDonald is President and CEO of MCD Partners Consulting and a member of the Bonheur National Leadership Council. So as we go through tonight, we ask you to put your questions in the Q&A tab. We will be monitoring those along the way. And as I said, we'll try to get to as many of those as we can. We will keep information coming to you since most of you have supplied your email addresses to us. We'll try to keep you updated by email updates afterwards as well. So with no further ado, let me ask Dr. Cynthia Cross to talk to us first about the basics.
Hi, everybody. Thanks for joining us. I know that you are tired of coronavirus and you're probably tired of hearing some of this information. We have learned a lot over the past 18 months, and we do know that the basics work, and those are masking. Some masks are better than others. Single fiber masks or single layer masks seem not to protect as well as multi-layered masks. Please cover your nose as well as your mouth when you put the mask on. Wearing it down here doesn't do much good. Wearing it under here doesn't do much good either. And once the mask is in place, try to put it there, press it to fit your nose, and just leave it alone. You don't have to take the mask down to speak. If you need to talk, just speak a little bit louder, but please try not to touch that mask. And when you're taking it off, try not to touch the front of it. Grab it by its straps when you're ready to take it down. Hand washing is also important. soap and water, or you can use the hand sanitizer. Make sure you get all the surfaces of your hands and between your fingers and under the fingernails, and don't forget your thumbs. If you use only hand sanitizer, it's nice if you can, excuse me, periodically make your way to a sink and use some soap and water, because as that residue builds up, it may make the hand sanitizer a little bit less effective. Social distancing works. These are the basic tenets of slowing the coronavirus. We know these things work. I know there's been some controversy about some of it, and I won't get into that. But evidence has shown that these things work, so much so that we also saw the decrease in other viruses during last cold and flu season. And I'll stop there.
Thank you, Dr. Cross. Let's go to Dr. Nick Highsmith for some information about this Delta variant.
All right, good evening, everyone. So we've already mentioned, Dr. Whitaker mentioned that the Delta variant is really in the headlines right now, and I'll speak about it for just a second. So for those of you who don't know, we've had several variants over the past 18 months since this pandemic began. We started with the original strain that was isolated in Wuhan, and we've since had 4 variants of concern. Those have been now they're called the Alpha, the Beta, the Gamma, and most recently the Delta variant. You guys will probably most likely remember the Alpha variant. That was the UK variant, and the one that we saw really come in and be the dominant strain here in the United States several months ago. Since that time, the Delta variant has pushed out the Alpha variant, and we're seeing it as the predominant strain here in the Mid-South and across the country. Of all the isolates that we've sequenced or sent for testing in the last several weeks, greater than 90% of those have been the Delta variant. That's important because the Delta variant is behaving a little bit differently. We know that it's more easily transmitted. So people are shedding more virus, or there's more virus coming out of their nose and that sort of thing. We do know that the virus is transmitted the same way, which is good. We know that the masks and what we've done in the past will be effective against this strain. We also know that it seems that the Delta variant is causing a little bit more of a severe illness. There's a lot of debate about that right now, but there are several indications from other countries that have seen Delta variant already that people are getting sicker with the Delta variant, and it's really targeting those unvaccinated populations. We also know that we're seeing an increase in our pediatric cases that has been going up over the last several weeks. And I think the question there is this because it's more transmissible and we're seeing more kids, or is it because Delta variant is a little bit more virulent and that it's causing more severe disease in children? And I think at this point, the data is still out there, but I think that from anecdotal evidence of what we're seeing on the front lines is that the Delta variant does appear to be causing more severe illness in our children. Which is something we never want to see. So we're looking at the Delta variant. We know that in looking at other countries, it usually comes up in the peak and then it goes down pretty quickly. So we're hoping that's what we'll see here in Shelby County, but I can tell you that it's causing a big strain right now in our hospitals. We have more hospitalizations across the system right now and across the city than we've had at any point during the pandemic. So that's a real somber fact to bring up here, but that's sort of where we are with the Delta variant, and I'll stop there.
All right. Dr. Arnold, would you speak to symptoms a little bit more? Dr. Highsmith covered a little bit there, but if you'll expand.
Sorry about that. I think everyone knows now what COVID-19 illness looks like. It can range from asymptomatic to a severe respiratory tract infection that lands you in an ICU. But most of those symptoms are generally those that we see with the common cold or influenza, and they range from runny nose and sore throat to cough and fever. There are also symptoms such as body aches, headache, vomiting, and diarrhea that we can see with COVID-19. With the Delta variant, it seems like from reports from other places that we're seeing more of this typical upper respiratory tract infection than maybe perhaps in the past, and less in the way of cough and fever, but more runny nose and sore throat. And that is making it difficult because we weren't wearing masks for a while. And so there are a lot of other viruses out there that we were not dealing with last year that overlap significantly with COVID-19 now. And it's going to be hard to be able to tell the difference between RSV and influenza and colds and parainfluenza and other coronaviruses that we typically get infected with. And so probably going to have more testing this year when children and adults fall ill. So generally, we need to be careful with any respiratory tract symptoms. You could be sent home from work. Your child could be sent home from school for having a new runny nose with instructions about when or whether you need to have your child tested. Please make sure you keep your children home and stay home yourself if you develop any respiratory tract symptoms, and either go get tested or just stay home until you're better, especially if you're vaccinated. You may just have runny nose. A lot of people are saying it just feels like having a little bit of a sinus infection when they've been vaccinated and they get COVID. And so that's why it's really important that you stay home and get tested should you develop any of these symptoms. So don't get too angry at your school if they send your child home because they have relatively mild symptoms. They still could have COVID. Take them and get them tested. And I think somebody else is going to discuss where you can get your child tested.
And you are right indeed. Dr. Highsmith, you're up next for testing, please.
Right, yeah. So this is something that we were dealing with a lot early on in the pandemic, and a lot of people will remember it was very difficult to know where to get a test, and there were a lot of places sort of popping up all over the city offering different testing capabilities. And then about a month ago, I would have said that that was an issue that we had completely put behind us, and that testing was no longer an issue. However, unfortunately, with the spike that we've seen, we are once again in a position where the reagents, the stuff that you use to do testing, is becoming in short supply across the country. So a lot of our rapid tests that you've seen in your pediatrician's office or in Walgreens and places like that are becoming in short supply again. So I would just say to everyone out there, if your pediatrician's office or places where you have gotten tested before still have testing capabilities, then that's definitely the place you should look to. We will have updated guidance as we get more information over the next couple of weeks, and we'll have that on our website at bonheur.org/coronavirus.
All right. And Dr. Arnold, would you talk to us about quarantine versus isolation?
Sure. These two terms can be pretty confusing, and a lot of people use them interchangeably. Honestly, it doesn't really matter what you call it. It's just knowing what to do when a particular thing happens to you. So it's easiest to start with isolation. Isolation means staying away from others when you have an infection. So you don't have to be symptomatic. We know you can be asymptomatically infected with this virus, but you still have to stay away from other people so that you don't make them sick. So for COVID-19, this means that you have to stay by yourself and really try to avoid any contact with other people. If you live alone, that's easy. You just stay home. If you live with others, you have to figure out a way to isolate yourself in the home and try not to expose the people that you live with to COVID-19. So this means staying in a room, trying to use a bathroom that only you use if that's possible, depending on your home, and only come out of that room when others are not around. Like if you need to go get food in the kitchen, make sure that you'll be the only one in there. And you should always wear a mask when you leave your isolation room, just in case you run into somebody else, but you're also breathing the air of the house and other people will be sharing that air. For COVID-19, isolation is 10 days, and that's 10 days either from your positive test if you're not having symptoms, or 10 days from the onset of your symptoms. And you can stop isolating after 10 days as long as you're feeling better and have been fever-free for at least a day. If you're still having symptoms at the end of 10 days and you're not feeling a whole lot better, or you're still having fever, you need to stay in isolation until you're feeling better and you've been fever-free for at least 24 hours. If you're immunocompromised, like you take medications that affect your immune system, for example, you could have to isolate for up to 20 days, and you should definitely talk to your doctor about that. Quarantine is what you do when you've been exposed to an infection and might be incubating it and therefore have the potential to infect people should you actually develop the infection yourself. This is done because you could become infected and contagious at any time in the days following your exposure. And with COVID-19, we know that you can be contagious either before you develop symptoms, or again, as we've already said, your infection can be entirely asymptomatic. So you're required basically to quarantine for the entire incubation period, and including that 10 days of isolation. So quarantine is a pretty long period, and it's generally 14 days for this virus. However, CDC said that we could probably shorten quarantine with a few different tricks. One is, well, it's not really a trick. If after 10 days you're feeling completely well and you're without symptoms, you can end your quarantine. So even though they prefer 14 days, they know it's very difficult for people. And 10 days, as long as you are completely well and have not had any symptoms at all, that would be fine to leave quarantine. The other option is that you can be tested for COVID after 5 days following your exposure. And if you're negative, you can leave quarantine after 7 days. So your quarantine can be as short as 7 days, as long as you have a test on or after that 5th day following exposure. It's important to remember a couple of other things. One, if you've been vaccinated against COVID-19, you are not necessarily required to quarantine as long as you remain asymptomatic. We do know that people who have been vaccinated can be infected. They don't get very sick, but they can still transmit virus to other people. So this is really important. You should make sure, if you are vaccinated and you've been exposed to somebody with COVID, that you are always wearing a mask when you're around other people, and you should be tested 3 to 5 days after that exposure. And if you're negative, you can continue to go about your business. Try not to be around many people. I mean, I wouldn't go to parties and concerts and things like that, but continue to be very careful with your mask wearing for that 14 days. But you don't have to necessarily stay home from school or from work during that time period. Some schools and places of work may require you to stay away in the days before you're tested. I've heard that about some schools, and I think that that's reasonable. It's just an extra safety precaution. And then if at any time you develop symptoms, even if you're vaccinated, whether you've been exposed to somebody with COVID or not, you, just like anybody else who develops any of these respiratory symptoms, should get tested. And then finally, if you've been exposed to COVID in your home and the infected person cannot isolate away from you, such as a child who's infected and you're their parent and you have to look after them because they're too young to care for themselves, then you have an ongoing exposure to that person until their isolation period is done. And your official quarantine period does not start until your exposure to that potentially contagious person ends. So your quarantine does not start until the end of that person's 10-day isolation period. Also, if you develop symptoms during your quarantine, then you have to get tested. And if you are positive, then your 10 days of isolation starts. So 14 days or 10 days are certainly not the maximum amount of time you could spend in isolation or quarantine. And if you have any questions about this, there are infographics all over the internet. The CDC has them. The Tennessee Department of Health has them. I'm sure that the schools have all kinds of handouts as well, because it can be a very confusing thing to follow.
That's great. And thanks for sending us to some evidence-based resources. That's wonderful. Before I let you off the hook, would you speak briefly to antibodies, please, Dr.
Sure. So antibodies are proteins in your blood that develop following an infection or a vaccination as a part of your immune response. They're a very important way that help the body fend off infections after you're exposed to them. And so COVID, like other infections, we make antibodies after that infection, but we also can make antibodies if we've been vaccinated and have not had infection. And of course, vaccination is a way to train your immune system to fight off the infection without having to go through the infection first. We're still learning a lot about what we need to be protected against COVID. And of course, that's a moving target, because now we have variants that may be able to escape our immunity to some degree. Right now, the Delta variant, as Dr. Highsmith said, can infect vaccinated people, although generally you're protected against getting very ill from COVID. And that's, of course, the most important thing, because everything that we're doing is to try to keep people out of hospitals. We're not going to be able to keep people from getting infected altogether. But like I said, we don't know how long the antibodies last. from COVID infection. We don't know how long the antibodies last from having the vaccine, but there are scientists that are studying these things and trying to figure out how much protection we have and for how long. There are very few to no reasons for a person to go and get an antibody test. Sometimes we check it in the hospital. With certain kinds of illnesses, we may want to know whether a patient has COVID antibodies and trying to sort out what's wrong with them, but that is a rare instance. For most people who are out in the community, there's really no reason to go and get tested. If you've had infection, you do have protection for a certain amount of time, but you're required to go through the whole quarantine and isolation thing should you be exposed to COVID more than 90 days after your infection. And then we've already talked about what happens if you've been vaccinated. Some people still want to get their antibodies checked to see if they're immune, but we don't really know how much antibody you need to be immune. And the way we measure antibodies in the blood, it doesn't give you information that is meaningful to you in any way. It's a number, and it's a weird way that we measure the amount of protein antibody in the blood, and it doesn't mean anything, and it really can just tell you as if they're positive or negative, but it doesn't tell you if you have enough of the right kind of antibody in order to fight off the infection. We think that being vaccinated, even if you've been infected, is a good idea because the vaccine will boost the natural antibody response you got to being infected and possibly provide greater or longer term protection. So we don't recommend going out and getting an antibody test and using that to decide whether you should go get vaccinated. You should just go get vaccinated regardless of whether you've had infection. And that way that you'll know that you have good longer term protection.
Perfect. Thank you, Dr. Arnold. And I'm going to ask Ms. Cindy Hogg to talk about back to school, but because Dr. Arnold did update a lot of the information along the lines of what she just said, I'll ask you first, Cindy, do you have particular comments you want to call attention to? I'll remind everybody our back to school recommendations are at our website, www.lebonheur.org/coronavirus. And Dr. Arnold and Dr. Highsmith, among others, addressed lots of those very technical points. And I certainly don't want to make you repeat any of them, but any particular additional comments on how we set that up on the document? Maybe not. That was for you, Dr. Arnold, but it's okay.
Oh, sorry.
Sorry.
Okay. I'm so sorry.
Well, I was going to go to her next. I'm sorry. That's my bad.
Totally my bad. All right.
I guess I'm sort of leaning here toward it's geared a little bit towards schools, not necessarily what to do at home. And though that a lot of that is included, that was sort of the lens it came from. Is that fair to say?
Yes. Yes, absolutely. I think the main things that we go through, like you said, is about what schools should do about preventing COVID-19. I mean, this is all stuff that we know that we've already talked about. It's masking, vaccines, hygiene, staying home if you're sick, getting tested. The things that and then also about what to do about cleaning the school and when you have a case and contact tracing and all of those sorts of things. I think that it's really important that people be very understanding of the schools, because they're going to, we all know, listen, we are all working parents here. We've all had children in school. We know how hard it is to deal with children who are sent home from school and can't go back for a period of time, and how disruptive that is to the child and how that disruptive that is to our jobs. But the school is just following the rules that have been set out by the state and local health departments in order to try to keep all the other children safe. The most important change that we made to that document was a very strong recommendation for all eligible people to be vaccinated. We're going to be posting some information on the Bonheur website about some of the COVID vaccine myths that are out there. There are a lot of things out there that are being said that are not true. And we don't want people to be afraid of getting the COVID vaccine based on misinformation. And so we're going to try to address some of that misinformation going forward, because this is really the most important thing we can do to get our children back into school and try to get our lives back to normal as much as possible.
Thank you. And sorry for the confusion. I'll say, and I am going to go to Ms. Hogg next, but let me say first that we did leave a lot of the general advice that we had on our back to school recommendations about the same as last year. We updated a few things in other sections. There is information about children with special healthcare needs, medical, educational, behavioral healthcare needs. A lot of that stayed about the same. But I know, Ms. Hogg, you've worked directly with schools, so I will this time ask you for your comments, please.
Thank you. Good evening, everyone. I do just want to speak to what life might be like in the schools. Our nurses, every school district is different. Not every district has a nurse in every building, so that can make it very difficult with contact tracing. If a child is found to be positive, the nurses are working very carefully with the teachers and seating charts and who were they by and how close were they and does this constitute a contact, and trying to make those decisions and working with the health department to determine the quarantine in those situations. So I would again reiterate, please be patient with them. And in some districts, it may not be a nurse that's handling those things. It could be someone else that's been assigned because they, as I mentioned, don't have nurses in every building. So they are working very hard to do that. We also, we encourage the mask wearing because we know that last year when kids were all wearing masks, we had some cases, but we were pretty successful with being able to maintain school and keep things as normal as possible for the children, and they are safe for children. There have been some questions about that as well. Children are pretty resilient and they take their cues from their parents. So if you could remember that, I know I have to be careful with my grandchildren to be sure I'm sending the right message, and we all get tired and we get weary, and we understand that. This has been a very long 18 months. And we are anxious and excited for school to be able to go as we would like to see it, as normal as possible. But if you can remember those stay-at-home measures. And one thing that came to me today, a parent sent their child to school not feeling well and said, well, we wanted the nurse to assess them and see if they needed to come. Please keep your children home if they are not feeling well. And please use your tactics as a parent to determine you know your child best, and if that is a symptom or a complaint that they have often, or is it something new, and please keep them home and let's determine that they are well before they return to school.
Excellent point. Thank you. Dr. Highsmith, would you speak a bit to child care centers, please?
Yeah, sure. So I think a lot of the information, that we've put out there can be extrapolated into child care centers. I think that, keeping the areas clean, we for the most part last year never had a lot of restrictions on child care centers in general. And we know that in those areas, there was not a lot of spread of COVID-19. So I think that we've sort of reiterated a lot of our recommendations from last year in this document, and don't really have a ton to add unless Dr. Arnold has something she wants to add on that.
Okay, but I'm going to toss to Dr. Arnold anyway and ask please to start a little bit of conversation on vaccines.
Right. So, there are 3 licensed vaccines in the U.S., the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. The only one that is licensed for children under the age of 18 currently is the Pfizer vaccine. So we can focus on that. The two, that's an mRNA vaccine. That's a new thing. It makes people very nervous because it seems very new and it seems like it just came out of nowhere. These have been in development for many, 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 many years. It's really important that everybody who is eligible for vaccine get vaccinated, and that includes children 12 to 18 years of age. There are small risks associated with vaccine, but they are on balance felt to be lower than the risks associated with the COVID pandemic. CDC is constantly monitoring the adverse events that come in from its various reporting sources. They've been doing this forever and they're very good at it. And the group that monitors this meets on a regular basis and reviews the data. And then they come out with a report that says the risk benefit ratio remains in favor of COVID vaccination. we need to be vaccinating everybody because it's the only way that we are going to get out of this situation where we are getting into trouble like we are right now with this surge that we're having with this Delta variant. If we can get fewer people infected, the chances of new variants emerging are much, much lower. And we're not just talking about the United States, of course, because these variants are coming from all over the world. It's a global community, and we're going to need to get everybody, truly everybody, vaccinated. But it starts at home. And so we need to be talking to our kids about vaccines. The kids need to be vaccinated. The parents need to be vaccinated if we're going to get out of this anytime in the near future. So if your children have questions, like I said, we're going to be putting more information up on the website. Please, please take them to your pediatrician and talk to your doctors. They know a ton about vaccines. It's half of their job is to give vaccines to children. It's what they do all day long, and they know a lot. And they want to be able to give you good information, not information that you're hearing from friends and coworkers who find information on the internet that may not be reliable. Just because it's printed somewhere, it doesn't mean that it's reliable. And it's easy to get scared. If you don't know what's going on, if you don't understand things about vaccines, which most people don't, they're pretty complicated. It's really easy to get frightened by what you read on the internet. You're worried that your children are going to be infertile. That's not true. Just as an example, there are so many things. This vaccine can't change your body. It can't change your DNA. Please go and get reliable information from somebody you trust with your health and with your child's health on a day-to-day basis.
Dr. Highsmith, anything to add?
No, I don't have anything to add.
I agree.
That was
That
great.
was well said. I just wanted to give you a chance, but I will actually go probably next to you to speak to, and that we'll start a little bit of the questions and some of the questions we've already had. Mask wearing, all of these precautions. Do you have a sense of how long and duration and how much?
No, yeah, that's a really great question that I would have had a completely different answer for you probably a month and a half ago. I think we all know a month and a half ago, prior to the Delta variant coming in, that we were all, eager to start the school year, and we knew that we wanted our kids to be in person, and we were excited about the low level of transmission that we had in our community with COVID-19. And we were excited to get everything sort of back to normal. Unfortunately, that's not where we are right now with the Delta variant, and we have a very high level of transmission in our community right now. And I'll say that based on what we've seen in other countries, and not to say that's exactly what's going to happen here, but the Delta variant has gone up very quickly and come down very quickly. So I'm hopeful that that's what we will see here in the South and across the country. So I think to project, to have sort of a crystal ball to see what I would, see in the next couple of weeks, I'm hopeful that if we can keep the transmission down, continue to have vaccinations up, keep masks on, for the foreseeable few weeks to months. And hopefully this will come back down, and we'll be able to start, chatting about, decreasing the transmission levels in the community, how they've decreased, and hopefully be able to relax some of the restrictions and some of the guidance that we've given. That's sort of what I foresee, and I hope it plays out that way.
And that's a fine point, that the situation has changed, and we're trying to help people keep up with what the current information is and how our community's going. Perfect. Thank you. And Dr. Arnold, had a question about other viruses. And I know you spoke a little bit earlier about influenza, RSV, other cold viruses, and how those are out there too. We haven't masked up for all of those. How do you see this as different? How is COVID a different thing?
So there are other viruses out there that can be harmful to children. And so a lot of people have questions. Well, every year we have children die from influenza, for example. Why are we making children wear masks? There's a lot of concern that children are having to wear masks to protect adults who are not getting vaccinated. And certainly the solution, we all know that the solution is for everybody to get vaccinated, of course, but that's not going to happen right away. And again, we still have the rest of the world to deal with, and the possibility of more more of these variants. Like Dr. Highsmith was saying, a couple months ago, we were a whole lot less worried about this, but now we're worried about it again. And even though I would love for my child not to have to wear a mask in school, unfortunately, the spread of this virus, even if children are not getting sick, they are helping to spread it around. And right now, our hospitals are getting overwhelmed. We are going to have a higher number of cases of COVID-19 in the hospitals than we've had ever during this pandemic. And that includes Le Bonheur Children's Hospital. And even though a lot of the kids in Le Bonheur also have other viruses, that's because we stopped wearing masks. Now, we don't usually wear masks during RSV and flu season. And we're not necessarily saying that going forward throughout the winter time, we're going to require everybody to wear masks. Although you might find that there are some people who are going to be doing that going forward, because we know that masks apparently work really, really well to prevent the spread of these viruses. And even though we were masking, we kept RSV and flu out. We didn't keep COVID out 100%. We still had a surge, and that's because, let's be honest, people don't wear their masks properly, and COVID is more contagious than those illnesses. We don't know what it's like in schools without mask wearing. As Cindy Hogg said earlier, we know that with all the things we were doing last year, we were able to keep kids in school and keep them safe. And so we need to keep doing that, because if we took away the masks, we don't actually know what would happen. It certainly wouldn't be the same as in adults, but just because fewer children get sick doesn't mean we should be letting them all get terribly ill. And some of them would get terribly ill. And any death in a child is a tragedy. That's an entire lifetime lost. So we shouldn't get caught up in, well, it's worse in adults and children, we don't have to worry. Well, it's not that we don't have to worry. We did a pretty good job of protecting them last year, and we need to be doing that this year while transmission is so high.
Exactly. Thank you, Dr. Arnold. And as to children with particular risk factors, someone asked about preemies, for example, but there are other risk factors that are similar adults to children, but maybe those risks are a little bit different. Could you or Dr. Highsmith speak to what sorts of conditions might make a child at more risk? Is it similar to in adults, or should we be thinking a little bit differently there?
So I think in some ways it's similar to adults. So probably the biggest risk factor is obesity. And the children who are the most ill that we're seeing in the hospital are those with high BMIs. But we're also seeing this in children who don't have good lungs, right? So children who can't clear their lungs very well, not necessarily preemies with chronic lung disease, but children who have neuromuscular conditions that prevent them from clearing their lungs well. Some of those kids are ending up in the hospital. Some of those kids are also overweight, but a lot of them are actually quite thin. So it's not a BMI issue in those. Diabetic children, children who are immunocompromised. You know, we don't have the same level of, say, type 2 diabetes, which is a very strong risk factor in adults in children as they do in adults, but we do have some of those children, and obviously that overlaps with obesity a great deal. Otherwise, healthy children still do end up in the hospital sometimes, usually the younger ones, the much younger ones, or it's teenagers. So there's sort of a sweet spot there in the middle where we're not seeing very many ill children, but we do see across all the age groups children getting MISC, which stands for multisystem inflammatory syndrome in children. And that is a post-COVID inflammatory illness. And we've had some children get extremely ill from that. Most of them have been asymptomatically infected. Many of them didn't even know they had COVID, although there were people around them who had COVID. They just never had symptoms or got tested. And Tennessee was one of the states with the largest number of cases of MISC during previous waves. And we are starting to see children with MISC, and that can hit anybody, and it can affect all the organs. It's called multisystem for a reason, but it can especially affect the heart, and it can be a really scary thing to deal with your child. And then finally, there's long COVID, which is something that we're learning more and more about. We do see similar types of syndromes after infections in the general population could really occur with any infection, but there really seems to be a very strong predilection for this post-infectious problem associated with COVID-19. And it seems to affect more than 10% of kids, somewhere in the 10 to 15% range, where they have prolonged fatigue. They may have prolonged loss of taste and smell, which can affect your nutrition because you don't want to eat if you can't taste things, or it alters your taste. Children who are having palpitations and chest pain, or gastrointestinal symptoms, or shortness of breath, or difficulty in school because they can't think the way they normally do. They have a brain fog. And there are articles in the lay press about this, quite a bit of it, where they interview kids who are going through this. And you don't end up in the hospital with that, but it sure does affect your life while you're going through it. And it can go on for months and months and be very debilitating.
Actually, a question for you, Dr. Highsmith and Dr. Cross, as to treatment. Monoclonal antibodies has been asked in the Q&A, but what is it like for treatment in general for children with COVID when they get to the hospital or otherwise?
You want to take that?
Okay. Okay, I'll go first. So it's first off, it's very frightening for the children, right, to have to be admitted to the hospital. It's concerning for their parents to have to be admitted to the hospital. Once they get there, it all depends upon what signs and symptoms they're having. So some of our kids are coming in just with dehydration, particularly younger kids. So those kids get IV hydration. If it goes on for several days, they may have a tube placed in their nose for nutrition, and we try to help them get over it. For kids who are sicker, kids with oxygen requirements, kids who are having a good bit of difficulty breathing, we use medication specifically to target that, and one is called remdesivir. That's a medication that can only be given intravenously. We also start them on steroids, and then if they don't respond to that, there are other medicines that we use. Many of these kids are sick enough to go to the intensive care unit. We are not always able to care for them on the pediatric floors. And this was a little bit surprising for us, right? Because the last few waves, the kids didn't really get hit very hard. And I think once they started getting really sick, it really caught the attention of most of us. I mean, we have more kids in the hospital now and in the ICU than we have had the whole pandemic. And it's a little worrisome. In fact, it's quite worrisome. As far as other treatments for MISC, that treatment is a little bit different. And I am not the monoclonal antibody expert, so I will stop there.
Yeah, and I'll just echo what you said, Cynthia. I think we've definitely seen a difference over the last several, weeks in what we've seen in our hospitals. I've told everyone we've had admissions at Bonheur in the past for COVID-19 through the different waves, but for the majority, it's been kids who have come in with some other illness or some other issue and then found to be COVID-19 positive. The kids that have been in our intensive care unit for the most part up until now have been kids, like Dr. Arnold was saying, that have come in with the multisystem inflammatory syndrome. So we've really had very few up until the Delta variant came into the area. We've had very few kids who have actually, had acute COVID-19 that has required their admission to either our respiratory floor or our intensive care unit. So it's all taken us by surprise, unfortunately, and we've had to reevaluate how we're doing things.
I'll just speak very quickly to monoclonal antibodies. So there is an emergency use authorization for the monoclonal antibodies manufactured by Regeneron. I will not say their names because I'll probably say it incorrectly. These are available for kids 12 and up who have high risk underlying conditions. The best thing for those children who are 12 and up is also to receive vaccine, but we know that responses to vaccine may not be optimal if you're immunocompromised, for example, and so there may still be a need for that in our most compromised children who could still get the Delta variant and potentially become ill. For children under 12, you cannot go to Methodist or Regional 1 to get, or Baptist to get monoclonal antibodies. But we do have a clinical trial open here. It's open label, which means there's no group that doesn't get the monoclonal. There are study procedures associated with that, so it's not as easy as just going and getting an infusion. However, if you have a child with a high-risk condition who becomes infected with COVID and has mild symptoms, they're not sick enough to be in the hospital, and that's the same for the emergency use authorization, by the way. You have to be infected and have mild symptoms, or at least for the EUA right now, you can also get it as post-exposure prophylaxis before you have symptoms, but you must have been exposed to COVID. But for the younger children, you have to actually be infected and have some symptoms. And if you go to the Bonheur webpage under research, you can find this study in the infectious diseases section, and there's an email address and a phone number. And we've been getting lots of phone calls, and we would love to give your child a monoclonal antibody infusion if they have one of those high-risk conditions and gets infected.
Thank you. Dr. Highsmith, you talked a little bit earlier about testing, and if I took notes properly, you said to go to your doctor. But we've had some questions about if a child does have some symptoms, maybe something mild, but they do have a negative test, can they go on back to school? I think I'd like to hear a little bit more about the different types of tests, just a little bit on that, and maybe the quality judgments you have to make.
No, yeah, that's a great question. And I would have answered this differently at the beginning of the pandemic as well. So I think early on, our testing capabilities were limited. So there are different types of tests. There are PCR tests, which normally take 6 hours to run, 4 to 6 hours. Those were what we had in the beginning. Those were sort of burdensome. You would come in, get a swab, go home, have to isolate until you found out the result, and it could be the very next day. Since then, we've had the development of some rapid tests. We've had a rapid PCR test, as what a lot of the primary care physicians across the city are using and what we use in our emergency department. That is done in about an hour. It's pretty reliable. If you have symptoms, then a positive test is positive. If you have a negative test, it's pretty reliable that you're actually negative. I think that where the confusion comes in and where there's a little bit of debate is what's called an antigen test. So that's where you swab the nose and you can have little pieces of the virus that is there on the Q-tip, and then you put it in a plate or a little well, and you see if anything reacts to the protein that's there. That one in the past has not been as sensitive, so it doesn't pick it up as often if it's really there as we would like. So that means that if you have a negative test, there's still a possibility that you could be positive. If you have a positive test, then you definitely, for the most part, have COVID-19. So I think there's some judgment that has to go into that. I think if a kid has a runny nose, a fever, and has been exposed to somebody that has COVID, and they go and they get a test and it's negative, I think you would probably have to pause a second and say, can I be confident that this is actually negative in this individual that's had a high risk exposure to somebody, say somebody in the household or something like that. But that's something to definitely chat with your pediatrician about in that setting.
That's a great point, that calling your own pediatrician, whether asking about a visit or calling a nurse line or somehow connecting and talking through your scenario really might be quite helpful. And I'll also mention that at our website, www.lebonheur.org/coronavirus, we have a list or link to a list of local public testing locations. And I'll pause if anybody who knows more than I do about that specifically wants to add to it, but we have a list there so you can figure out where to get your child tested. Dr. Cross, a question for you. Speaking of these symptoms, it's allergy season. Sometimes it's always allergy season for some of us, but late summer tends to be a hot time for allergies as well. Could you speak please to those sorts of symptoms? What's different about that, if at all?
Unfortunately, not much difference between the runny nose you get from your allergies and the runny nose you might have with coronavirus. So still, we need to look at those kids from the standpoint of what other signs or symptoms of illness that they're having, what's their exposure been, and if there's any question, those kids are still going to need to get tested, unfortunately. If you know your child's an allergy sufferer, maybe you can get ahead of their allergies by starting your controller medicine, if you will, now before they get sick. Then if they break through that, there's probably even more concern that it probably isn't just their allergies. On a personal note, my daughter was isolated at the facility where she lives for 3 months to protect her. And when she was finally able to come home, she looked at me and said, "Hey, Mom, I think my allergies are acting up." Well, guess what? That was coronavirus, and we both ended up getting it. So it can look exactly like the allergies, unfortunately.
Yes.
And I think Dr.
Unfortunate. Go ahead.
Yeah. And I think Dr. McCullers mentioned yesterday that if you're vaccinated, it looks even more like just an allergy flare because
So
it's milder.
And so unfortunately, that does mean we need to keep vigilant for all of it. But the good news is that maybe those milder infections won't feel so bad for everybody right away, but we want to keep from spreading it around. To vaccinations, I believe we've covered this sort of, but let me just ask it straight out. Do we know when we'll expect vaccinations available for children under 12? I think the answer is no, and I think it's later, several months at least down the line, but would our experts please comment?
Sure. So the two companies, Pfizer and Moderna, are doing trials. So Moderna just published their 12 to 17-year-olds. So that's going to now be available for younger kids soon. At least the 12 to 17-year-olds, which is good because that's the shot that a lot of the doctor's offices have. A lot of them aren't stocking the Pfizer vaccine because it comes in larger quantities and they don't have enough people to give it to. So I don't know how that's going to work, but it's possible that your pediatrician's office or your doctor's office could have that in the future. For the younger kids, the under 12s, obviously, a lot of what we're doing is also to protect them since they can't be vaccinated. They are that for the 6 to 11 segment of that group, we are hoping that we'll hear something late in the fall or the early winter before the end of the year. They are getting ready to submit their data to the FDA, and then the FDA has to review all that data in great detail. We obviously don't want them to cut corners. People are worried that the vaccines aren't safe enough because things are moving too quickly. They need to take their time, look at the data properly, and then have a meeting and issue a recommendation. And that would again be an emergency use authorization for that age group. We're hoping to very, very soon have full biologic license approval. It's called a BLA for the vaccine for the age groups that are currently approved. For Pfizer, that would be down to 16 because that was what their original EUA was for. And for Moderna, that would be down to 18. And that's just the companies submitting all this. It's mostly logistical information that they have to submit to the FDA, and then the FDA has to review that and make sure that they're ready to receive that full approval. And that's going to be very soon. And we're hoping that a lot of people will feel better about getting those vaccines once they receive full biologic license approval.
Perfect. Thank you. And I know you addressed this a little bit earlier, but I'm going to rephrase it just for clarity. How long should a person wait to get a vaccination after having had COVID live virus?
So there's really no specific waiting period that you have to have before you can get vaccine. Many people have been recommending you wait 90 days. You're considered protected for 90 days. You don't necessarily, after you've had infections, you don't necessarily have to run out and get it right away. But there's really no harm in going and getting it. You certainly need to wait until you're completely over your infection. You don't want to potentially be infecting anybody by going and getting vaccinated. There's certainly no benefit to getting vaccinated once you've been infected. Some vaccines can be used as post-exposure prophylaxis, but we don't have any data to support doing that. So stay home until you're better so you don't infect anybody else. And then really you can go whenever you want after that. There's no reason to wait. Your first dose of vaccine may feel worse than it does in other people. Since you're boosting your immunity, you already have a good immune response from your natural infection, kind of how some people felt worse. If you look at any of the data from the vaccine trials, the symptoms that you get from vaccine, those local symptoms of a sore arm or feeling feverish or unwell, fatigued, aches and pains, that sort of thing, headaches, after your second dose of vaccine are usually worse because you have an immune response already and now you're boosting it and your body's making all kinds of chemicals that make you feel lousy for a short time. That could happen after your first dose if you've been infected, so you shouldn't worry if that does. It's very short-lived. Some people do feel quite terrible, but nothing bad happens to you from those symptoms. So just stay the course, take some Tylenol if you feel sick, curl up in bed and watch some Netflix.
That's a good solution for a lot of things. Would you speak briefly before I let you go on third boosters? For some adults, third boosters are recommended, as I understand it, but that is not something we are seeing for kids.
Right. So right now, so for the people that are vaccine approved, so I think it's down to 12, the third dose. So people are calling it a third dose rather than a booster because really we're giving it to people who may have had an inadequate response to 2 doses, not because their immunity waned, which is why we would boost antibodies with a booster shot of a vaccine. It's really a third dose to try to get them to where people with healthy immune systems that are not suppressed by medications get to with 2 doses. To try to improve their protection. And so that's now out there. Pfizer and Moderna are going to be submitting booster dose data to the FDA to get that approved. That doesn't mean that it will be recommended, right? So the FDA approves vaccines, but the CDC, the ACIP, which is an arm of the CDC, their vaccination arm, they approve, that's the Advisory Committee on Immunization Practices. They're the ones that meet every couple months and they talk about all kinds of vaccines, but they're obviously spending a lot of time talking about COVID vaccines and safety and efficacy. They would be the ones to meet and decide whether it's a good idea for everybody to get a booster dose of the current vaccine. What we need to know, and I think the data that they're going to submit says that boosting your antibodies up higher, even though they won't be specific to the Delta variant, will provide additional protection. That's really what we need to know from those companies. But we also think that there will be vaccines that contain the variant in the future as well, and variants that come up down the line, because COVID's not going anywhere and there will be new variants at intervals that will cause us problems. And these vaccines are well designed for that. We're used to that because that's what happens with the flu shot every year. And these vaccines, it's much, much simpler to do. And they won't be new vaccines. It'll be the same vaccine with slight little tweaks to the sequence, the genetic sequence of the mRNA, so that it matches the virus that's circulating and causing problems. So that might get approved. I don't know whether it will be recommended. We're trying to use vaccine doses all over the world to try to get everybody vaccinated. There are all kinds of issues around that other people are going to have to sort through and figure out. But we'll see what the companies say about their booster data when it gets submitted to the FDA and they review it.
Perfect. Thank you. And that's a fine example of it's a changing situation that we have to review the new information as it comes to us. And again, we hope to be a resource for everyone. We are out of time really, but we will have a send off and promise you that we'll keep updating our website. Again, it's www.lebonheur.org/coronavirus. As we have information to share, we'll be glad to put it out in that venue. I wanted to toss this to Dr. Mary McDonald to give us some words of wisdom.
Thank you, Dr. Whitaker. Last year, for the most part, we lived virtually. This year now, we are learning how to live with coronavirus. And that means going about our lives as safely and as normally as possible. This is especially true for the children at our schools. Parents are the first teachers and decision makers for their children and want to make informed decisions. You seek and expect good advice from the schools and from trusted healthcare professionals. There are so many voices and so many opinions that it becomes very confusing. The purpose of this task force is to, in an ongoing way, provide you with the latest and most professional information to help you make those informed decisions for yourself and for your children. We are urging you to please keep practicing the basics of good hygiene and sanitation and refer to the guidance on the Bonheur.org website. Thank you for being on here this evening, and thank you for the job you are doing as parents in making that informed decision for your children. I want to thank our task force for their dedication to making and supporting you in these decisions and for providing the ongoing advice. We are not going anywhere. We are going to be on the website. We'll have more of these webinars as needed. And we want you to know that we are all in this together and we are part of your decision-making process. So thank you. Thank you so much, parents, for taking the time to learn more so that you can share that with your family and with your friends too. These are informed decisions that we want you to make. Thank you and good evening, and have a great rest of the night.